Have you ever tried to stop worrying, only to start worrying about the worrying itself? For millions of people, that cycle isn't occasional. It's daily, and it has a name: Generalized Anxiety Disorder. Generalized anxiety disorder is a long-term condition marked by persistent, excessive worry about everyday situations, even when the danger is unclear or unlikely. Stress, in small amounts, is a natural part of life. It helps us stay alert. It helps us solve problems. It helps us respond to challenges. It is the body's way of preparing us for life. But in generalized anxiety disorder, that helpful signal doesn't turn off. The stress response becomes constant, far exceeding what the situation calls for. For most people, worries appear and fade, but in GAD, they accumulate. Work, health, family, the future. Small concerns stack on top of each other until the mind is carrying more weight than it was built for. The mind becomes crowded. Too many possibilities, too many imagined threats, too many unanswered what-ifs. It feels like the brain is juggling thoughts it never asked for and can't put any of them down. And because the mind and body are connected, the body reacts. Muscle tension, chest tightness, stomach discomfort, headaches, restlessness. The body prepares for danger that isn't there. So the person becomes alert, over-alert. Small things feel important. Simple tasks feel heavy. And in an effort to avoid more anxiety, they may begin avoiding life itself. Generalized anxiety disorder rarely comes from a single source. It develops through several overlapping factors. Genetics play a role. Brain circuits that regulate fear can be more sensitive. Early stress or unpredictable environments can teach the brain to expect danger. And personality traits like sensitivity or overthinking can increase vulnerability. GAD is created by these influences working together, not one cause alone. Generalized anxiety disorder is challenging, but it is also treatable. Recovery doesn't happen overnight, but with the right support, the brain can learn to quiet its alarms. One of the most effective paths forward is psychotherapy. A trained professional helps someone understand their patterns and fears with clarity. Among these approaches, cognitive behavioral therapy, CBT, is especially well supported. CBT teaches practical tools to challenge unhelpful thoughts and respond to uncertainty with greater calm. For some people, medication can also help. Selective serotonin reuptake, inhibitors, and serotonin norepinephrine. Reuptake inhibitors can reduce symptoms and help stabilize the body's baseline anxiety levels. They don't erase fear, but they make the mind more responsive to therapy and coping skills. And there are everyday habits that support recovery. Mindfulness, breathing exercises, regular movement, consistent sleep. These practices signal to the nervous system that it no longer needs to stay on high alert. And perhaps the most important step is understanding yourself with compassion. Anxiety is not a personal failure. It is the mind's attempt, sometimes an excessive one, to keep you safe. And you are not alone in learning how to quiet that alarm. Thank you for watching the Think series, Psychology Edition. If this documentary brought you clarity, consider subscribing for more human-centered explanations about how the mind works.